Welcome to Special Education with Hamid Naqvi. Last week, Punjab Public Service Commission announced 153 vacancies for special education teachers in the field of mentally challenged children. And to help them prepare for the written examination, we are starting a series of videos. Since the written examination will consist of 100 MCQs, out of which 80% would be subject oriented, so here are some videos which are being uploaded to help the candidates in their preparation. So let's start. First most favorite question which is asked in MCQ form is, what is the primary age criterion for diagnosing intellectual disability? The options are before 2 years of age, before 5 years of age, before 18 years of age, and at any age. Well, first let us understand the question. The question is, what is the primary age criteria? That is, what is the standard where we diagnose whether it is intellectual disability or not? The answer is that before 18 years of age, if we find the symptoms of intellectual disability, then we say that it is pointing towards that. Now we know it very well that at least three characteristics are required. One is that the potential child should be subnormal intellectually. Second, he or she should have deficiency in adaptive skills. And third important is what this MCQ is referring to, that these characteristics should be seen or observed before the age of 18. So intellectual disability is diagnosed when symptoms appear before the age of 18. Next MCQ is, which of the following is a common characteristics of intellectual disability? Common characteristics of intellectual ability, we have to find it out. Is it high IQ, difficulty with reasoning and problem solving, advanced language skills, or exceptional memory? The most common characteristics of intellectual disability is difficulty with reasoning and problem solving. And we may explain it in this manner, that intellectual disability is characterized by significant limitation in intellectual functioning, as we mentioned in the previous slide. And number two is deficiency in adaptive skills. And number three is the time at which those symptoms must start appearing. So difficulty with reasoning and problem solving is most common characteristics of intellectual disability. Another MCQ is, which of the following is not a category of adaptive behavior? Which of the following is not a category of adaptive behavior? Conceptual skills, social skills, practical skills, and academic skills. We know it very well that first three, that is conceptual skills, social skills, and practical skills, these three are subcategories of adaptive behavior. So the fourth one, that is academic skill, is not a category of adaptive behavior. As I've just explained to you, adaptive behavior is generally divided into three main categories: conceptual skills, in which is included language, reading, writing, mathematics. Then second subcategory is social skills, which include interpersonal skills, social responsibility, self-esteem, and the third main subcategory is practical skills, which include personal care, job responsibilities, money management, etc. So academic skills, the correct answer is academic skills are not important. They are not a separate category in adaptive behavior assessment. Another MCQ is the most common known genetic cause of intellectual disability. Now, what is the most common genetic cause of intellectual disability? Is it Fragile X syndrome, Down syndrome, Prader-Willi syndrome, or Angelman syndrome? The correct answer is Down syndrome is most common known genetic cause of intellectual disability. And why it is so? Because Down syndrome is caused by an extra copy of chromosome 21. This is the most common genetic cause of intellectual disability, and it leads to a range of physical and intellectual challenges, and it is a well-known condition globally. Then what type of intellectual disability is often associated with difficulties in motor coordination and daily living skills? Now, the question, try to understand that what type of intellectual disability is associated with motor coordination. Motor coordination means movement and daily living skills. Is it mild intellectual disability, moderate intellectual disability, severe intellectual disability, or profound intellectual disability? The correct answer is profound. In profound intellectual disability, we have difficulties in motor coordination and daily living skills. Profound intellectual disability. And we know it very well. There are four shades as they are mentioned: mild, moderate, severe, profound. And the difficulties in motor skills or daily living skills is in the last or the most extreme type, that is profound intellectual disability. Then which of the following IQ ranges is typically associated with mild intellectual disability? We know that mild, moderate, severe, profound, they have got different IQ ranges. So the possible IQ ranges may be 55 to 70, 40 to 55, 25 to 40, or below 25. Mild, moderate, severe, profound. The question is, we have to tell which is associated with mild intellectual disability, and the answer is 55 to 70. And we have already mentioned, and let us repeat, that 55 to 70 is mild, 40 to 45, 55 is moderate, 25 to 40 is severe, and below 25 IQ is that for profound. Then an individual with intellectual disability who requires significant help with personal care and communication likely falls under which severity level? Mild, moderate, severe, or profound? Now, the question is an intellectual disability who requires significant help in personal care and communication. So obviously the answer is third one, that is severe. And we know the characteristics of mild, moderate, severe, and profound. And this type of difficulty, That is significant help with personal care and communication falls in the third category, that is severe. Next is which of the following is an example of a conceptual skills in adaptive behavior? Personal hygiene, money management, following social norms, self-esteem. We know it very well that there are three subcategories of adaptive skills. Number one is conceptual skills, and under conceptual skills we have got different types. The question is which of the following is an example of conceptual skill? The answer is money management comes under conceptual skills. Conceptual skills, let's know a little more in detail. Conceptual skills in adaptive behavior include language, reading, writing, and money management. So these skills involve the understanding and processing of information. Personal hygiene is a practical skill, and following social norms and self-esteem are part of social skills. Another MCQ: which syndrome is leading genetic cause of intellectual disability in males? Now here specific, the question is regarding males, and is often associated with symptoms such as delayed speech and hyperactivity. Is it Down syndrome, Fragile X syndrome, Rett syndrome, Turner syndrome? The correct answer is it is Fragile X syndrome. Fragile X syndrome is most common inherited cause of intellectual disability in males. Mark it, in males. It is associated with features such as delayed speech, hyperactivity, and sometimes autism-like behavior. Turner syndrome and Rett syndrome are unrelated to Fragile X, and Down syndrome affects both genders equally. What is the primary purpose of adaptive behavior assessment in diagnosing intellectual disability? To determine the severity of intellectual disability, to compare the person's ability to societal expectation, to measure IQ, or to identify emotional problems. So, what is the primary purpose of adaptive behavior assessment? That is the question. The answer is to compare the person's ability to societal expectations. And adaptive behavior assessment, we know, measure how well a person performs daily life tasks compared to societal expectations for their age, and this includes evaluating conceptual, social, and practical skills. IQ tests measure cognitive ability, not adaptive behavior. Next is which of the following is not a potential cause of intellectual disability? Prenatal exposure to alcohol, severe malnutrition, postnatal head trauma, or high IQ. The answer is high IQ is not a potential cause of intellectual disability. Of course, it is a low IQ, less than 70. Then, which intervention is often used to help individuals with intellectual disabilities improve their daily living skills? Which intervention? Cognitive behavioral therapy, special education and life skills training, psychodynamic therapy, electrostimulation, convulsive therapy. The correct answer is special education and life skill training help individuals with intellectual disabilities to improve their daily living skills. Then next question is which of the following is a common prenatal cause of intellectual disability? We know very well there are three main causes: prenatal, perinatal and postnatal. Prenatal, perinatal and postnatal. The question here is which of the following is a common prenatal cause of intellectual disability? Is it measles, genetic disorders, poor parenting, or sports injuries? The answer is genetic disorder is the common prenatal cause. Genetic disorders such as Down syndrome or Fragile X syndrome are common prenatal causes of intellectual disability. Poor parenting or sports injuries do not cause intellectual disability, and measles may cause complication, but it is not a primary cause. Which of the in which level of intellectual disability are individuals likely to need supervision for daily tasks but may also live independently with sport? Mild, moderate, severe, or profound? The answer is moderate intellectual disabled are likely to need supervision for daily tasks but may not live independently with sport. So individuals with moderate intellectual disabilities typically need supervision but may live semi-independently with sport in a structural setting. Mild intellectual disability allows for higher independence, while severe and profound generally require more constant care. Then, what is the purpose of an individualized education program IAP? To help teachers earn higher salaries, to provide specialized support tailored to the students' needs, to reduce school attention requirement, to limit social interaction. The answer is to provide specialized sports tailored to students' need. That is the purpose. Then which of the following skills would likely be taught in life skills program for individuals with intellectual disabilities? Algebra and calculus, job interviewing techniques, literary analysis, none of the above. The correct answer is job interviewing technique, obviously, because for life skill programs, someone requires some jobs, employment, and for which job interviewing techniques are required. Which medical condition is most commonly associated with intellectual disability and distinct features including a flat nasal bridge and almond-shaped eyes? Down syndrome, Turner syndrome, Williams syndrome, or Prader-Willi syndrome? Answer is Down syndrome because Down syndrome is caused by an extra chromosome 21 and is associated with intellectual disability and unique physical traits such as a flat nasal bridge and distinctive eye shape. Other syndromes listed do not have these specific characteristics. At what age range do developmental delays typically begin to indicate potential intellectual disabilities? 0 to 5, 5 to 10, 10 to 15, or 15 to 20 years? The answer is 0 to 5. Signs of intellectual disabilities such as delays in motor skills, language, or cognitive abilities often appear between 0 to 5 years of age. Early intervention is crucial during this period. Which of the following is an important adaptive skill that can help individuals with intellectual disabilities become more independent? Advanced mathematics, effective communication, abstract reasoning, and emotional intelligence. Answer is effective communication, because effective communication is crucial for independence, helping individuals interact with others, request help, or express needs. Which term describes the support provided to individuals with intellectual disabilities in areas such as communication, social skills, and self care? Psychotherapy, adaptive assistance, behavioral modification, or social support? The answer is adaptive assistance. Adaptive assistance, we know, includes support in practical areas like communication, social skills, and self care. They are essential for helping individuals with intellectual disability function effectively in daily life. Which of the following tools is commonly used to assess intellectual functioning in individuals suspected of having intellectual disabilities? DSM-5, Vinland Adaptive Behavior Scales, Wessler Intelligence Scales, Beck Depression Inventory. Answer is Wessler's Intellectual Scale. Wessler Intellectual Scale is widely used tool for measuring IQ. We know it very well. Whereas DSM Diagnostic Statistical Manual provides diagnostic criteria for mental disorders. Which of the intervention is most effective for improving outcomes in young children with intellectual disabilities? Restricting interaction with peers, providing a specialized diet, enrolling in early childhood and special education programs, avoiding educational activities. The correct answer is enrolling in early childhood special education programs. Very obvious, very simple. Best of luck. See you in the next video. Till then,